Hi, everyone, and welcome to the Canadian Centre for Policy Alternatives webinar, Assessing the Pandemic's Economic Impact on Women's Lives. I'm Amanda Klang, Senior Communications Specialist with the CCPA National Office and your host for today's webinar. I'm speaking to you from Tiohtià:ke, the Mohawk name for the island of Montreal, and this is the western edge of the Haudenosaunee Confederacy, which is one of the longest lasting participatory democracies in the world. We recognize these unceded territories here and across Turtle Island and the many settlers and Indigenous people upon it. We look to a future that is better than the present, and this is what guides our work here today. But we also know there is much work to be done. Okay, first, a little housekeeping. We're so pleased to have so many of you joining us today. Please give a shout out in the chat where you're joining us from, and know that you can ask questions via the Q&A module, and we're going to try to get to as many of those as we can. And thank you to Women and Gender Equity Canada for supporting our project. It's a pleasure to share our findings today. Okay, I'm going to introduce what we're all here about. So this is part of a multi-year project called Beyond Recovery, led by CCPA senior researcher Catherine Scott and carried out in collaboration with the CCPA's Nova Scotia, Manitoba, and BC offices and our community and academic partners. Along with Catherine, we have 3 of our researchers here today to talk about their findings. 4 years ago, COVID-19 turned our world upside down. Airplanes were grounded, tourism vanished overnight, all but essential stores were closed. And unless we were considered an essential worker, we either lost our jobs or worked from home, learning how to do Zoom and forgetting to put ourselves on mute. No one went unscathed by the pandemic, but women were especially hard hit. From day one, Catherine Scott worried that this would set women's advances back by a generation. Catherine, take us back to those early days when the world was shutting down and no one really knew what would come next. What happened to women in March of 2020?
Thanks, Amanda, and thanks for that kind introduction. And thank you to all for joining us here today. We're very excited to be presenting our findings. I'm thrilled to be on a panel with my colleagues and with Amanda and the rest of the team that helped put this tremendous project together. March 2020, it's actually, it's hard to get, believe that it's been 4 long years really since, as Amanda said, our world turned upside down. And as she noted, we were concerned from the get-go about what the impact was going to be on Canadian women, what it would be for Canada's progress toward more gender equal and equitable society. Long story short, our project actually particularly concerned with the economic fallout. Millions and millions of women were initially impacted in the spring. Over 2.8 million women lost their jobs or were working less than half the regular hours of employment as a result of the necessary public health closures that were introduced at that time. But a particular group, and I'm going to ask Craig to throw up just to set the context for the session, a particular group of workers was particularly hard hit. Craig, can you throw up there we go. One slide for this presentation today. Unlike past recessions in, early 80s and 90s and so forth that really exposed export sectors like manufacturing, this was a unique recession that really particularly hit low-wage workers the hardest. Overwhelmingly women, highly racialized, newcomers and the like. This chart here just sort of graphically shows how many people looking at that period in the spring of 2020 lost their jobs. Over half of all low-wage workers earning less than $14 an hour lost their jobs or a majority of their employment. And that was upwards of 60% of women in this income group as well were targeted. So as you can imagine, Young women were hugely hit, newcomers, and mothers. Mothers really took huge initial job losses. Basically, 1 in 4 mothers with kids under 12 experienced job loss or reduced their hours of employment to stick handle what was an emerging crisis for their families. And many have not still yet come back. So huge impacts. This was a unique recession, and it uniquely impacted women.
And Catherine, what about women who weren't facing employment loss? What was happening for them?
Well, for everybody, of course, the pandemic not only it impacted the care, women's, unpaid care labor in the home, which, as we know, is intricately connected with their paid employment status. So in addition to lost jobs and income, women obviously faced a huge rise in unpaid care. Think about taking care of loved ones who'd fallen ill, homeschooling, provisioning, shouldering what was keeping their families together at that time. You talked about Zoom calls becoming the norm, and we saw the pets and the kids running in the background, but the day-to-day, not so fun, right? Like, it was a very stressful time, particularly for mothers that were stick handling homeschooling and the like in provinces that had closures. The other, and I just want to hasten to say these challenges were exponentially harder for women facing challenges, women with disabilities, Indigenous women, and racialized women who were facing unique challenges in the context of the crisis. The other thing I'd like to flag, certainly that was hugely important, was the rise in gender-based violence that we also saw during this time. Like, we don't talk about it explicitly in the project, but it really set the context. Women were literally locked in their houses with their abusers at a time when they had no or reduced support from the community. So truly, it was a difficult time for women.
That's so much going on at once, so much for these women to juggle. Then there's another category we haven't mentioned yet, which is the women who are considered essential to the economy and care work. So
Yes.
what happened to those women in March 2020?
Well, this is all sequential. It was like set of dominoes, wasn't it? You have massive losses among, certainly targeting low-wage workers. Other women, and this includes folks who are working on the front lawns in grocery stores, and Alice is going to tell us about hotel workers, but women engaged in frontline essential care work were not at home during the pandemic. They were going every day with the fear of bringing the virus home to work, to their families, often on crowded buses, with dealing with service shortages and the like. So another group of essential workers. And when the pandemic hit, of course, what it effectively did was it blew open our systems of care and support. The problems in our care service, healthcare, and like obviously predate the pandemic, long underinvestment, inadequate planning, all of the like, all of that was happening in the background, years of austerity, but the pandemic threw fuel on the fire. So almost immediately, staffing shortages emerged as care workers fell ill, and they struggled to balance their care at home with their work. Their mental health and physical health deteriorated as they strove to provide care shorthanded, often without needed supplies or protective equipment. You'll remember on long-term care wards, PSWs dressed in garbage bags, and just the extraordinary, the crushing workload, the hostile work environment with the public that was not, became increasingly angry and hostile. It was truly a devastating time in the care economy. And we see this today, and we can talk about it later on. Like, the problems that were precipitated by the pandemic continue. Workers are running on empty. It's been a really challenging 4 years for care economy workers.
And those workers were considered heroes in the beginning for all the reasons you described, considering the circumstances they were facing.
Banging pots.
How long did that last?
No, that was a moment. That moment most certainly has passed. It passed quite quickly.
Right. And what happened to women as time moved on and we surfed multiple COVID-19 waves where the economy opened and closed multiple times? What happened in those?
Well, during the immediate crisis, and we did a big report looking at, what was the government response to the immediate crisis? Did it prioritize what we knew to be the gendered impacts of the crisis? In a federal country such as Canada, you have certainly the federal government stepped up. It was the largest player. It bankrolled the health response on the part of the government, rolled out a national vaccination program and the like, introduced, and from our perspective, in terms of economic impact, introduced really important series of income security programs when it was completely clear that EI, employment insurance, was going to horrifically fail, countless hundreds of thousands of low-income workers that would not be able to secure support and were thrown out of work. So there's huge response in the sense of the federal government. On the other hand, when we look at the care and like all of the demands on, families and women and the like, particularly around care, hugely hit and miss. Large groups of marginalized women did not receive the support they needed. You have provinces that didn't even deem shelters an essential service during the time. There were provinces that refused to introduce wage top-ups for care workers and were reluctant to be dragged kicking and screaming into the child care agreement. And obviously another big policy innovation during this period. So in Canada, I would say the response part of governments was hit and miss, and many, many people fell through the cracks.
Mm. And Catherine, you've been tracking women's progress or regress all these years since the pandemic began. Did women ever recover?
Well, I think, when we look back over this period, and I've spent the last 3 years looking at what's happened in the labor market. I think there, for me, there were, three sort of trajectories, as we talked about low wage workers that, they have been on an economic roller coaster for 4 years. Really difficult in many industries like accommodation and food services, personal services, self-employed women, folks running hair salons and the like, they've still not reported. Their employment levels are still below what they were before the pandemic. And of course, we've in the subsequent, 2021, as the economy started to rebound, the cost of living took off. And, so you have a group of workers with low wages to begin with, of course, their wage gains, and similarly, folks in the care economy fell behind the higher and higher march of cost of living, shelter, food, energy, gasoline. So that particular group of workers had a tremendously difficult and are continuing to have huge economic struggle.
So this is basically just as you'd feared in March 2020.
Yes.
Was there any good recovery news for women in the months and years that followed?
Well, no, certainly like unequal pandemic, unequal recovery. Talked a bit about certainly really important groups of female workers who continue to struggle. But another group, and I think it's really important to emphasize, actually, well, one group, of course, was hardly touched at all. Folks who were able in white collar employment that did not, didn't experience, an interruption in their income or employment. They have cruised forward. But what was interesting is the economy started to reopen. It was really a unique moment, tight labor markets, high demand. A large group of women workers were able to pivot into higher paid employment. And that was really one of the most important things we've seen. And this in a context where we have high levels of immigration, this is quite interesting. It was quite broad-based. The women that have been moved up the earnings ladder included Indigenous women, newcomers, immigrant women moving into higher paid professions in professional services, for instance. You can think about the legal profession, accounting, administrative sorts of supports. So that is really quite positive. You saw a strong rebound in employment levels for groups that have historically faced really significant employment challenges, but, always a but. When we look at what's going on in those new, among that new group of women who have sort of moved up the ladder, a lot were channeled into lower paid occupations. So you have this really perverse finding where you have higher levels of employment and better paid employment, but the wage gap with men actually is rising. So in professional services over the last 3 years, the wage gap increased by 3 percentage points. So women are because, the truth was that men's wage gains were much higher than women's. So basically widening the gap. So, classically, the definition of 2 steps forward, 1 step back, or you can't win for losing. But the gender wage gap, certainly in those higher income professions, remains a particular problem for the group of women that pivoted into that work.
Okay, yeah. Well, thank you so much for this, Catherine. I'm going to come back to you a little bit later to talk about solutions. But first, we want to talk with 3 researchers who were part of case studies in BC, Manitoba, and Nova Scotia. And to our viewers, I'd like to invite you to type any questions you might have of Catherine in the Q&A module. and we'll get to as many as we can later in the webinar. But first, we'll hear about the experiences of hotel workers in British Columbia. In March 2020, the hotel sector was hard hit. No one was going anywhere. The pandemic wreaked havoc on the women who work in that sector. Alice Mourage is a PhD student at the Faculty of Health Sciences at Simon Fraser University in Vancouver. She has a master's degree in public policy from Willy Brandt School of Public Policy at the University of Erfurt in Germany. Her current research focuses on health and social inequities associated with health emergencies, including the COVID-19 pandemic, as a research fellow with the Pacific Institute on Pathogens, Pandemics, and Society. Alice worked with colleagues from SFU, the BC office of the CCPA, and Unite Here Local 40, which represents hotel, food service, and airport workers throughout BC. Alice, you led an important study of women hotel workers in BC. What happened to those workers in the early days of the pandemic?
Thank you, Amanda. With travel restrictions and closures, about 50,000 BC hotel workers were laid off with very little clarity on when or if they will be able to go back to work. And the hotel sector did receive government wage subsidies, but these were not conditional to returning laid off employees. So, while they were receiving the significant financial support, some hotels eventually terminated many workers who thought they were temporarily laid off. And many who were brought back to work eventually as restrictions eased, had their work hours reduced, and these were inconsistent, with some workers essentially being shifted as on-call scheduling. Workers simultaneously experienced increased workloads due to understaffing. Yeah.
So it sounds like a huge amount of turmoil and uncertainty for those workers.
Yes.
Can you give a little more description of what conditions they were facing at the beginning of the pandemic? So in terms of job security, economic security.
Yes. So our study essentially involved focus group and interviews with 27 workers working in the industry across the province, and majority of whom were immigrant and racialized women. And we wanted to understand these experiences and how changes in the hotel industry affected the quality of work and life. So as hourly paid workers, the unpredictable work scheduling that came after they returned to work, this translated directly to unpredictable and inconsistent incomes, and workers really struggled to meet their basic needs. They experienced food and housing insecurity, and some were forced to take other jobs to supplement their earnings. And this taking on additional jobs further complicated the challenges of responding to the short notice and on-call work. Yeah, so it was challenging. And maybe it also speak to kind of the work conditions. So at the beginning of the pandemic, when COVID-19 cases were high, some hotels did not standardize the COVID-19 protocols, including training of workers. Many workers got infected, and those who lived with loved ones who had underlying conditions, they felt like they had to choose between having an income and the health of their loved ones. And as I noted earlier, one of the notable changes that workers highlighted was the increased workload on return. This resulted in increased, these unsafe work conditions resulted in increased levels and severity of injuries to unprecedented levels in some hotels, with some workers being forced to take short-term disability. And there were also increased cases of harassment and abuse by hotel customers. So it was really a challenging time for workers.
Mm-hmm. So you've described the challenge, the difficulties for hotel workers at the start of the pandemic. You've also touched on the difficulties when there was a return to work after many of the workers who'd been laid off without knowing anything about whether they return or under what conditions, but ultimately many did, and the conditions were very difficult. I'm wondering, was there any collective action by those workers to respond to what their employers were subjecting them to, from dangerous working conditions to insufficient pay and changing work schedules that were difficult? Was there a collective action?
Yes, yeah, workers did come together, and they were also noticing what is happening in terms of employers' response to the pandemic, because despite, for example, recovery that was happening at the time, they were terminated, and some of those who were terminated actually came together collectively. So unionized workers, they formed this campaign called British Columbia Unequal Women. They launched public actions. They went on strike at their workplaces over the mass terminations and also the work conditions. And to some, concerns were raised within the workplaces, but some remained unaddressed, with some workers not being able to raise these concerns because of fear of retaliation at a time when job and income insecurity was high, especially for non-unionized workers. But those who are unionized came together, and particularly those who were terminated, demanding for their jobs, and some were successful in doing so. But some, even at the time of the interview, were terminated, and they were looking for a way to come back into work. And some women even staged hunger strikes on the steps of the BC legislature to urge the provincial government to step in, to intervene in protecting the jobs of those workers who are laid off by adopting temporary recall protections. And unfortunately, during this time, the government declined to intervene, citing primacy of securing recall rights through collective bargaining between unionized employees and employers. But we noted that at this time, other North American jurisdictions were actually strengthening and protecting hospitality workers' rights during the pandemic. So there was a lot of actions, but they had those kind of hoops to jump to be able to secure their work safety. But what we are also seeing is that these conditions that were being experienced at the beginning, including high workloads and understaffing, are unfortunately ongoing in some hotels.
And so, considering that, what is needed now to improve the lives of hotel workers? And has the BC government taken any action to protect those workers?
So the BC government definitely needs to step in, and they need to take action to protect workers' health, well-being, and rights cannot be left solely to employers, especially those who are employed under precarious conditions. Specific actions were made clear through the project, and these have been outlined in our report. First, the government should safeguard workers' right for recall in case of layoffs during health and other emergencies, including through policy protection, conditional emergency benefits to employers. And also to help to address income insecurity, the government should introduce a predictive scheduling regulation to limit that on-call scheduling that really affected and continue to affect workers. And also to enable affordability and mitigate housing and food insecurity among workers, the government should work towards increasing the minimum wage to a living wage and further support retirement supports or security for low-income seniors. And lastly, to safeguard workers' rights, health, and well-being, the government should improve the enforcement of work safety standards.
Okay, lots left to be done. Thank you, Alice, for these important insights into women hotel workers. To our viewers, I would like you to type any questions or comments you might have for Alice in the Q&A module. That's not the chat function. Okay, now we're going to move on to the case study of Manitoba's long-term care workers. Niall Harney is the Errol Black Chair in Labor Studies with the CCPA's Manitoba office. He worked with the Manitoba government and General Employees Union and CUPE Manitoba to capture the experiences of frontline personal support workers and home care workers. Niall, take us back to March 2020 and those early months of the pandemic. It wreaked havoc on Canada's long-term care facilities. What happened?
Yeah, so in just about every province in the country, long-term care became sort of an epicenter for some of the worst effects of COVID-19. So as Catherine just reminded us of the experience of long-term care workers using garbage bags in lieu of PPE, many workers were facing the issues of having to choose between bringing the virus to work or bringing it back home. So it was an incredibly stressful time for these workers. But at the same time, we also saw that 43% of deaths in Canada from COVID-19 occurred in long-term care, despite long-term care residents making up just 1% of the national population. So this really, at the time, sparked a national discussion around what's going on in long-term care in our country and how did we get here. And two things really emerged from that public discussion. One was around the ownership structure of long-term care. So there were many journalists at the time who were doing really excellent investigative research showing that the rates of infection and death from COVID were much higher in these for-profit private long-term care facilities than in the nonprofit public options. And then at the same time, it really sparked this conversation around working conditions and their effect on the conditions of care within these facilities. So there was lots of research and writing being done about the low wages that many workers within these facilities were working for, the precarious working conditions and the split shifts that people had to take working at multiple sites just to put together full-time hours, and that this had really contributed to the level of infection, and that the system had been chronically understaffed for many, many years before COVID came in. So as Catherine mentioned, COVID threw fuel on the fire in this situation.
And can you tell us how bad it was in Manitoba in particular, where you were looking at this?
Yeah, so Manitoba had the second highest number of COVID-related deaths per capita after Quebec. And here in Manitoba, we really again saw this stark contrast between public and private long-term care facilities. So one of the highest profile examples was the Maples Personal Care Home, which you mentioned in Winnipeg, where 8 residents died in a 48-hour period, forcing the health authority to call in assistance from paramedics and the Red Cross. And the tragedies at the Maples Long-Term Care Home resulted in the Stevenson Review in Manitoba, which found that this chronic level of pre-existing staffing shortage was exacerbated by the illnesses and the illness-related absences that COVID brought on.
So this would have been very hard on the workers, these conditions, this systematic setup. Can you tell me some more about their experience?
Yeah, so the study that we did as part of this Beyond Recovery project was a survey with home care workers and long-term care workers in the province of Manitoba. So we surveyed 1,027 workers from this continuing care sector who are part of the unionized public sector in the province. And the survey results that we found really showed that this outsized burden of really, really hard work conditions that have been placed on care workers during the heights of the pandemic in many ways hadn't been lifted 2 years after. We did this survey in July 2022, and at that point, this burden really hadn't been lifted. And so the severe impact of understaffing on stress levels in the sector really jumped out as a major trend in our survey. So 69% of the long-term care staff that we surveyed and 75% in home care reported that staffing levels in their workplace were worse than prior to the pandemic. And over 2/3 of staff in both long-term care and home care reported working short-staffed at least a few times per week in 2022. And so this chronic understaffing is really producing this vicious cycle of burnout, leading to more staff attrition and higher rates of time off due to work-related physical and mental health issues. So 6 in 10 of the continuing care staff that we surveyed reported sustaining an injury on the job. And 4 in 10 reported taking more than a week off due to mental or physical health issues caused by their work. So this chronic understaffing is creating burnout, it's creating injuries, and it's leading to higher numbers of staff leaving, which is then causing the other people who are left in the sector to pick up more of their work, which sort of intensifies this negative feedback loop.
Mm-hmm. And yeah. And like the hotel workers, this sector, long-term care, is predominantly made up by women, often racialized women and newcomers. So can you talk a little bit about the workforce in long-term care?
Yeah, so from our survey, we certainly found that it's women in this sector who are bearing the brunt of this burden of care. So based on the respondents from our survey, 86% of the staff in long-term care identified as women, and 91% in home care identified as women. And then at the same time, about 28% of staff in long-term care identified as newcomers to Canada, and 38% in home care. And we really think that this underrepresents the true number of women who are new to Canada in this workforce. So previous studies have estimated around 70% of long-term care staff in Manitoba are born outside of Canada, and 60% in home care. And so perhaps the most concerning finding that we found in our survey was that over 60% of staff in these two sectors of the care economy said they're either very or somewhat likely to leave the profession in the next 5 years. And if this really comes to pass, will have devastating effects for the sector, and recruitment and retention efforts really won't be able to, or recruitment efforts won't be able to address the loss of staff.
So basically, the pandemic exposed how unprepared, unequipped the long-term care and home care systems were for such a tragedy. Have lessons been learned?
Well, yes and no. I mean, from our survey, the major issue that came up were these staffing numbers, so addressing this chronic understaffing that existed before the pandemic. And we have seen some movement on this with the new government in Manitoba. So just last month, the government signed a bilateral health agreement with the federal government, which brings in $199 million over 5 years to bolster seniors care. And that includes $37 million a year to hire staff to achieve a higher standard of care, 4.1 hours of care per day by 2027, which is this is the baseline that the Health Standards Organization says is necessary in long-term care. So that's a positive step forward, but we really found in our research that this needs to go higher, and it's one thing to bring the funding in, but creating recruitment and retention policies is another step, and we have some recommendations around that in our report. But what we didn't see in this bilateral agreement was that funding to bolster the home care sector, the public home care sector. So we did see funding for self and family managed care, which is stipends that individuals can get to manage their own care. And this is really critical additional funding, but we didn't see that funding to bolster the public long-term care system. And this is a missed opportunity in Manitoba. Here, we still have a majority of home care is performed by public healthcare workers. And this is a strength of our system. This is where we can provide those high quality working conditions. And there's other researchers who we worked with who found that in the private sector, working conditions, particularly for immigrant women, can be much more exploitative. So ensuring that we're bolstering positions that are available full-time in that public sector is really important. And we're hoping to see that in the next budget.
Okay, thanks, Niall. We'll be having a bit more time to talk about solutions going forward towards the end. For now, I'd like to invite our viewers to type any questions you have for Niall into the Q&A module, which again is not the chat function. Next, we're going to look at the case study of immigrant and migrant workers in Nova Scotia. Maria Jose Jacques Fraser is a PhD candidate at York University and a community researcher and advocate for migrant and immigrant workers, immigrant women, excuse me. She worked with Dr. Catherine Bryan from Dalhousie University's School of Social Work, the Halifax Refugee Clinic, and the team at the CCPA's Nova Scotia office to undertake the study. Maria Jose, your research team surveyed women who were considered to be in essential jobs at the start of the pandemic. What did you discover about them?
Good morning, and thank you for having me. At the time of the pandemic, the immigrant women and migrant women that we interviewed were working in what has been known as survival jobs. In the lexicon of immigration settlement service, but also in the academic discussion and literature, the term survival job has long been used to signal temporary employment intended to ensure the survival of immigrant women and all immigrants upon arrival in the country of resettlement. Reflective of the labor market stratification and exclusion, survival jobs are most easily accessed in sectors where the pay is low, hours are part-time, and formal protections are limited. As a result, migrants with a range of skills and levels of experiences, my apologies, find themselves disproportionately employed in low-wage care work, food production and provisioning, cleaning and sanitation, retail service, and hospitality. In the context of COVID-19, many of these jobs concentrated in feminized and increasingly racialized sectors were redesigned as essential. So in our study, we explored the employment experiences of immigrant and migrant women in the sectors that came to be recognized as essential during the various waves of COVID pandemic to understand the underlying links between essential work and survival jobs. So between 2022 and 2023, our research team interviewed 27 immigrant and migrant women working in sectors that were deemed essential to flatten the curve of spread of the virus. And so when we talk about immigrants, we are talking about permanent residents. And when we talk about migrants, we are talking about temporary foreign workers, international students, refugee claimants, and spouses that were accompanying their their husbands that had permanent status. So at the start of the pandemic, these women that we interviewed, they were working in the care sector, in food production and provisioning, in hospitality, and the immigration and settlement sector. And they had degrees in nursing, social work, psychology, history, arts, law, engineering, IT, and education. And most women work across the essential sectors as cleaners, food retail workers, and caregivers in both long-term and home care and the settlement sector.
Okay, thank you for that portrait. What did these workers experience in their work lives? Like, how difficult were the conditions?
The participants spoke of experiencing increasing precarity. They also spoke about the impacts that they have on their mental health and well-being. But also they spoke about the strategies that they used to survive COVID. And so reflecting on their experiences, many of the participants actually wept or became emotional during interviews with them. From their narratives, we could identify 3 interrelated challenges that underpin these women's mental health during COVID, which are the working conditions, which typically worsened during the pandemic, isolation, separation from the family, from the country of origin, and the navigation of the immigrant system for many of them. So while some of the women experienced a decrease in working hours, most of them felt their workload also increased during the pandemic. For some, this was accompanied by additional pay, but for many, it was not. And also some of them that were in the care work sector, their their job was not considered essential, although they did consider essential because they were responding to the immediate needs and they were sort of face to face with the in the care sector, in the immigrant sector, welcoming newcomers, for instance. So in most instances, and particularly for those in food services, it was the result of diminished profit in terms of the working hours, prompting employers to reduce hours for them. So this increased their precarity, their financial precarity. The workloads increase not only because of the sanitation requirements to prevent the spread of the virus, but also it was related to staff shortages, which were at times the result of workers resigning because they felt unsafe. And it was interesting to hear most of the participants say that they felt some sort of obligation to remain in their jobs because they felt that they were responsible for the well-being of the people that they served. So many struggle with the psychological aspect of doing frontline work at the start of the pandemic and throughout, particularly those that were providing care.
And did things improve at all for these workers as the economy began to reopen, as the pandemic began to recede?
Well, in the months following the economic shutdown, the women struggled to recuperate. For many of them, it was the struggle of recuperating in terms of their mental health and well-being, the stresses that they experience. For others, the rapid acceleration of food prices, housing costs, and other expenses have been impossible to manage to improve their situation, given the lingering effects of the pandemic. Also, the lack of affordability that increasingly characterized life in Nova Scotia has meant that the Canadian earnings don't stretch nearly far enough, particularly for some that have the responsibility to send money back to their families abroad.
You just mentioned women sending money back to their families that are abroad. So we're talking about immigrants and migrants. Can you talk about women workers' unique experiences as immigrants? Many were on temporary work or study permits, I believe. What impact did that have?
Well, an important lesson that we learned from the pandemic is that when faced with profound crisis of reproduction, seemingly immovable systems can move. So for instance, healthcare systems previously off limits to many of our participants were suddenly able to and willing to recognize their skills and education. So some of them who came as international students or temporary foreign workers with degrees in nursing had the opportunity to transition to work that was more in line with their training. So they were better positioned to exit low-wage work during the pandemic because they were able to take advantage of labor shortages in the province to secure improved conditions and earnings in hospitals or publicly funded long-term facilities. So in a sense, it did the opening up and the willingness of the government to accept their international credentials allow them to move forward.
Has government taken other action? Has the Nova Scotia government or the federal government done anything beyond that to improve the lives of immigrant women workers?
I understand that the provincial and federal representatives have received a report to find out if the government is listening to these experiences and recommendation. Really calls for a second phase of our research, so applying for funding that will cover a living wage salary to look at the government responses is like a second step to our research. But as a community research practitioner who has worked in the immigrant settlement sector and for the past 30 years and who has been involved in conducting this research, I am concerned about listening to the Minister of Immigration announcing a soft cap on the number of temporary residents and temporary foreign workers, using verbs like immigrants, using statements like Canadian employers or the country has become addicted to temporary foreign workers. It is very distressing to me because it places the burden on temporary foreign workers. It identifies them as a disease of some kind. It also making the links that he just did yesterday between the soft cap measures to address housing pressures. It's adding to the scapegoating of temporary migrants and distracting it from corporate and government failures to ensure access to affordable housing. So this is a form of racism that goes against the idea of creating welcoming communities that are inclusive and diverse, and against the idea of a fair society with equal rights for all.
Thank you, Maria Jose, and thank you for bringing these crucially important findings to light.
Thank you for the opportunity.
Now we're going to get to our attendees' questions. We have a number of questions from you. Thank you. We're going to do our best to get to them in the remaining minutes. So the first question is from Mumtaz Begum. It's for Catherine and Alice. Here's the question. It appears that government policies were highly influencing women's labor market experiences during and after the pandemic. If we consider from a policy perspective, what are the different policies, both economic and welfare policies, that require change or reform? Catherine, maybe you could weigh in.
Big question. Back in 2020, lots of feminist organizations and labor unions and the like talked about what a just and a gender just recovery would look like, and identified many policy solutions that potentially certainly would not only ease the lives of workers and communities in the midst of the crisis, but actually transition to build back better. That was the term we all talked about, to build back better, because clearly the pandemic illustrated the glaring gaps in our welfare state systems, the glaring gaps in the ways that our labor market worked. Maria Jose was just talking about, obviously, the structure and the way that Canada and the labor market in Canada exploits temporary workers. This number of years later, I think there are really important things that we need to be doing to address, like I can talk about income security programs, for instance. Our employment insurance system was wholly inadequate. It was simply not going to work. It was very clear within weeks that was going to fail, and hence why the government had to do that in massively fast pivot. Federal government brought in those new programs. EI reform, so coming out of that experience, those programs obviously wound down in 2021. There are a long list of recommendations to improve and strengthen our income security architecture in Canada, EI being a critical example, yet the government's dragged the puck, and we haven't actually seen any substantive reform that actually would create a much more inclusive and supportive EI system in the event of the next crisis, which will be coming, economic or otherwise. There are reforms as well. We can talk about further about what's needed to strengthen the care economy, and that's such a pressing set of issues right now, as we look at what's happening in the healthcare system, or as we look at toward building an inclusive and high quality public childcare system. The same problems that were magnified in the pandemic are basically undermining those efforts. That's critical. And I'll flag a third, and we should pick it up. Certainly what has to happen in terms of employment standards. What is the floor in Canada? What does the labor market for low income workers, who number millions and millions, or maybe fewer of them at this point in time, but that is a massively large employment group. And again, what action have we seen since then? Not much on that front as well.
Okay, thank you. Alice, did you want to briefly add anything?
Yeah, what was made clear in our project is that the pandemic costs were downloaded onto workers through strategies such as labor flexibilization that came through through on-call scheduling, and also cost-cutting strategies such as understaffing. So, you know, for me, those two issues are important in terms of policy. So how do we ensure workers are not just on-call workers, that they have a sustainable income? And how do we make sure that work safety is secured? And especially in a context where we are seeing the hotel industry and other industries have received a green light from the government to increase their portion of workers who are temporary, so temporary foreign workers. Are we creating a situation of precarity for workers in the industry and across many, care and service sector? So we really need to think, like, the government really needs to step in on this. Thank you.
Thank you, Alice. Okay, I have another question. This one is from Sultana Jahangir, and it's for Catherine and Maria Jose. All reports and research that prove that low-wage, precariously employed immigrant women are most impacted by the pandemic are now in a poverty pandemic. What recovery steps have been taken by government to help them recover soon? So this is for Catherine and Maria Jose.
Maria Jose, did you want to start?
Well, I think that, as I mentioned previously, I really don't know what steps the Nova Scotia government has taken or the federal government to respond to the situation of immigrant and migrant women. One of the things that we are recommending is the salary, for instance, for immigrant and migrant women working in the settlement sector. They are very poorly paid. They are not, a lot of them are not paid a living wage, which in Nova Scotia is, well, there are many, it's between $25 and $30 an hour, and not all of them get paid that. So I think from my perspective, it's a process of advocacy that, part of this report, the results of our research is to advocate for the improvement and the response of the government. But as I mentioned, I think we need to do another study to find out exactly what the government is doing at the moment.
I'll just quickly say, and I'm conscious to, we want to get to lots of questions and happy to respond offline too. What was clear certainly as we at this juncture 4 years out that, really, there was a moment, as I said, back in 2020, 2021, we were talking about building back better. But at the same time, groups that privileged elites in our country were mobilizing to put the toothpaste back into the tube to, you'd had a year of really massive increase of state intervention to facilitate and float Canadian families and businesses. And on the economic side, so we've encountered tremendous resistance to reform of employment standards, bringing in paid sick leave, which would have been obvious, so glaringly short as the experiences immigrant workers experience going to those jobs on crowded transit, and not having access to paid sick leave. You saw the federal government bring in 10 days, but of course, they just cover a sliver of the labor market. Continued resistance on many provinces to improve that. Continued, and at the same time, as Maria Jose, we have what appears to be the institutionalization of temporary worker programs in Canada, the growth of the foreign temporary worker program, the obviously new oversight of migrant and temporary workers, international students and the like, that's going on at the same time. So, the community is saying what we really need to be talking is reforming the immigration system. We need to recognize immigrants of different groups of immigrants. Canada has been historically very focused on high-skilled, high-waged, and privileging access, which creates terrible precarity for folks in different types of jobs, such as those in the care economy. But we seem to be institutionalizing a growing tranche of labor, which will just be an exploited underclass of workers in Canada, and that really is a pressing challenge in this moment of high levels of immigration, that we're institutionalizing the further segregation in the labor market that will only disadvantage a very vulnerable group of workers.
Thank you. My next question is also for you, Catherine. This is from Christina Hajar, and here's the question. In your research, have you found that CERB repayment disproportionately affected women?
CERB repayment, I haven't seen the data on the breakout of the number of folks that were claimed CRA. Of course, this is an issue that emerged at the time. CERB was a very flexible program that was introduced with very poor communication. Hundreds of thousands, literally millions of people applied for CERB. At the height, it was around 8 million or so. And the government promised at that time that they would be, you know, it was basically you could claim it, and then the government would come in after the fact and determine whether you actually had been eligible. And so you see this wave of conflicts with other programs, people getting kicked out of other, you know, social assistance, you know, there was, you know, it was chaos. And, 2-3 years after the fact, government is now coming back after low wage workers, many women, to repay these debts, or debts that the government claims, whether for whatever, not weighing in on the specifics, but people who are facing tremendous financial hardship now under these CERB repayment orders. I don't know whether women have been disproportionately. I can tell you that women were more likely to receive CERB payments, like we know in terms of the folks that did, because they were more likely to be the low-income workers that were impacted negatively and didn't have access to EI. So they now face most likely the disproportionate weight of those repayment orders that's still going on, as I understand.
Mm-hmm. Thanks, Catherine. I have another question. This one is for Alice. It's from Naz Jetha. What can we do to change how women are treated? How can we broach the government to address the lack of support for women?
We did, when we spoke to the women, they mentioned feeling devalued, their work and themselves as workers being devalued, both systematically just because of their work conditions, of their low incomes, but also through their interpersonal, relationship with their managers and how they're being treated by their employers. So, what I think needs to happen if we are really valuing the workers, one of the things is to really ensure that their wages are a living wage. So that is a systematic way that the government can actually, work on. And this is also an industry that is really not well unionized. Only 3.5% of workers in the accommodation and food services sector are unionized, compared to almost 30% of the working force. And it is through these unions that workers are able to fight for their rights, able to kind of negotiate their income, their work conditions. But yet there is a lot of resistance for workers, being unionized. I think that right of unionization needs to be needs to be kind of front and center, and employers need to make sure that they are not interfering with unionization conditions, and the government should support unionized workers. So that relationship with the government unionized workers needs to improve, and also encouraging workers to be unionized as one of the limited options for fighting for their rights in very precarious work conditions and work arrangements.
Thank you, Alice. I have a question from an anonymous attendee. This is for Catherine. Catherine, with the rise of remote working jobs, how do you anticipate this will change the nature of work for women in the future? And I know it's a big question, if you could keep it a little short.
No, really short. It's an interesting question around remote. At the peak of the pandemic was upwards of, close to 40%. That's trended down, but the levels of remote and hybrid work are much higher now than they were pre-pandemic, for sure. One up and probably in the 1 in 4, 25%. Remote work, it's one of those double-edged swords. It has been a remarkable opportunity for a lot of groups that have been, like people with disabilities, people facing aggression of one sort or another, disparities, to access better employment. So remote work offices obviously is economically beneficial for many families facing high costs of living, those that were able to relocate, you know, obviously don't have the same level of commute or stress in their lives, an important work-life balance. But, you know, as I said, double-edged sword. I mean, you know, the studies are going on right now. You know, it's also true that folks away, and certainly in professional or white collar work, folks on remote are considered typically have less access to promotion and job development opportunities and the like. There's a suggestion or an implied position, particularly if women are doing it, they're not as committed to the work, that they are less, they will be less, you know, it creates part of the glass ceilings that, you know, form in companies and the like. So I think, you know, there's great work to be done about what this moment means, but it is hugely impactful, and there's no, quite clearly, we're not going back. So people have to navigate that, but, you know, and obviously the outcome will be high, you know, hugely gendered, and as that impacts women in their work-life balance.
Thank you, Catherine. As everyone can note, we are out of time, but there are still more questions. So we're going to extend the webinar for 10 minutes for anyone who's able to continue with us. If you have to leave, no worries. You'll receive a recorded copy of this session in your email. But before we continue with questions, Catherine has a quick word of thanks that we would like everyone to hear.
Yes, I wanted to take the opportunity to thank everyone involved in the project, certainly to first and foremost, my collaborators, certainly in the BC, Manitoba, and Nova Scotia offices of CCPA, and our community partners, Halifax, including Unite Here, and the 2 Manitoba CUPE and government service workers, and the Halifax Refugee Clinic, really important participants in and all of the people that participated. Want to thank again our funder for with Women in Wage Equality Canada, who provided some partial funding for this project, and to assure folks we will be launching a project page with all of the reports and so forth, and findings collected. There are many reports, actually, well, many. There are some other project findings that will be published and on the new CCPA website, and we'll apprise you of all of that as well. You know, the hope is the work will go on. There's a long agenda. And certainly we flagged many issues that we need to pay attention to, and that's certainly our intent moving forward with our researchers to push forward on, you know, looking for a gender just economy and future for all women in Canada. So just wanted to say that and give my thanks.
Excellent. Thank you. Thank you, Catherine. And thank you to everyone who is staying with us. So I'm going to continue with a few questions in the 10 minutes we are giving ourselves to continue. So the next question is also for you, Catherine. It's from Dorothy Gossie. And she's wondering, did you notice an increase in unionization during the time period we're discussing?
Well, you know, that's a great question. I mean, Alice just raised you know, how critically important it is when we were talking about labor standards. Facilitating unionization is certainly a critical strategy to improve the lives not only of women, but obviously all working people in Canada. There was a moment, certainly, in, you know, with tight labor markets and a lot of agitation. You saw a wave of unionization movements, certainly in the United States. You see some of that here in Canada. Back in 2022, there has been an uptick in certainly certification. You know, interestingly, in BC, you've got the BC government that brought in reforms that made the union certification process, got rid of the two-step certification process, which facilitated and easier, but you know, slow progress certainly has been noted, but, you know, huge barriers, you know, particularly as we look at the changing labor force, remote work. If you think about that, you know, the challenge of mobilizing workers. We have issues with gig work and platform work. We have, again, you know, here in Ontario, where I'm located, you've got the provincial government that's brought in a package of employment standards that's separate for gig workers, a lesser. They have refused to include them under the, you know, Employment Standards Act, which would have recognized them as employees. So there are large fights yet to wage to press forward on rights for unionization for these workers.
Okay, thank you. I have another question for Catherine. This is from L.M. Little, who would like to hear, What actions are under discussion to clarify jurisdictional responsibilities, especially in the care sector? Provincial and territorial governments are getting ensnared in the privatization push, and the feds are allowing it. And Canadians, especially women, are the losers.
Yeah, no, I agree. No, I think this is, the bedeviled in our Canadian welfare state and the tension, federal, provincial, territorial tensions that, shape a lot of policy in this area. We have the childcare program that's obviously was really hugely important intervention the federal government took in 2021 in that budget. After, let's be clear, after 50 years of steadfast, 50 plus years of steadfast advocacy, the women's movement and other gender equality orgs and childcare sector pushing for a program, large sum of money attached for a 5-year period to build out a national childcare program through a series of bilateral agreements with provinces and territories, which had, legislation governing it with a set of principles and the like. But, obviously the devil in our federation is invariably in the details and how that's playing out. What type, the initial push was around affordability, but now we're, really stuck on the horns of a dilemma around the crisis in the care sector, thwarting the actual development and expansion of spaces. You have private sector, private providers in the childcare space trying to, get larger exemptions, larger amounts of money, public monies to support profit and the like. It really is a work in progress. And I mean, certainly childcare advocates are mobilizing to ensure the development of an inclusive, high quality system. But, the barriers as represented by the provinces to the systems that they will build remain really acute. And you also have new big players like private equity coming in and trying to scoop up, it's a very complex system. And that is a good example. You have similar sets of agreements that have just been signed for gender-based violence orgs, yet no idea how that plays out. These, again, no standards in long-term care. The government put, $3 billion on the line and money into developing a new set of long-term care standards. And then, but before it all sort of stopped, then said, these are voluntary. So, we had thousands and thousands of seniors died in our long-term care homes. And yet our federal government and the provinces, what action have they taken? We have new standards, but they are not tied, the money that we transfer from federal government to support those, like there are no conditions attached to that money for the implementation of these standards. So, it's a bit challenging. We've really, truly, the pandemic illuminated all of these graphic disparities that are baked into our systems of one sort or another. And yet where we are in terms of moving it forward, we really have not seen the action we would have hoped to have seen, given that it was so glaringly obvious. The problems are now so glaringly evident.
Thank you. Catherine, Tracy Edward wants to know, since the pandemic continues to affect women in the care economy, will this research be continuing?
Yes.
And, okay, nice easy
Yes.
answer. And in addition to the economic impact, has there been or will there be any study about the lack of public health standards and safety enforcement in some sectors compared to others?
Don't know about that. In terms of the public, it's not my field. Certainly, I do know that, in the academic world, many studies, much money was attached to the study and follow-up, and some of that work will start trickling, coming to fruition and start coming out. And I would be surprised if there wasn't a good deal of focus. And I know scholars and workers in that area looking at improving standards and, practices, hopefully tied to that. I can talk to the work I know about, and certainly the work at the CCPA. It remains one of our top priorities to look at an inclusive, equitable labor force. It redoubles my effort, not only care economy work, but basically, what's low wage work look like going forward, who is being increasingly concentrated doing that work, what type of working conditions are attached to that, how can we improve that? Certainly we will continue to focus on in putting forward policy alternatives around employment standards and the like, and in income security reform as well. Those are top priorities for the CCPA right now.
Thank you. I think I might have time for one more question. This one also for you, Catherine. This is from Bradley West. For the wage gap in professional sectors, was it the same for unionized and non-unionized? And if not, what are the potential forces behind the wage disparities?
I don't have the data. I haven't seen the data broken out by union and non-union levels. Lower levels of unionization and professional services just generally. So I would imagine it's a smaller sector. You know, these are jobs, you know, if you can imagine, you know, accounting and we talk about or legal services and like, so women are moving in larger numbers into bookkeeping roles or occupations like you know, administrative office managers or those types of role where there's large disparity in the law profession. It was just crazy, the income disparity among male lawyers or male legal professionals as compared to female legal professionals. You know, in terms of, you know, there is this, you know, literature around the types of barriers women continue to face, a lot of in American literature looking at things to do, how you create a culture that's more inclusive, where remuneration is not necessarily attached to people capable of doing excessive hours of employment. Those are really big drivers of some of the wage disparity, really large wage disparities in professional service or in corporate. You see huge wage gaps really at the very top of the income scale as well, like massive. It's an interesting, I will say just to finish, where you see the lowest wage gaps, and my colleague David McDonald's just looked at public and private sector workers, of course, are in the public sector and largely unionized, who very successfully reduced wage disparities, not only between women, but other, you know, other groups, marginalized groups as well, particularly at low and modest income individuals and workers. So yes, being in the public sector is definitely beneficial for your paycheck in that regard.
Indeed. All righty. Well, thank you, Catherine. And we are now at time. So I'm sorry we couldn't get to all of your questions. If you had a question, you can email Catherine and send it. And you also know that you'll receive an email with a recording link and further resources. So thank you for joining us today. And of course, thank you to our illustrious panelists today.
You, Amanda.
Thank you to
Excellent.
Amanda as well.
Mhm.